Okay, so just waiting for some participants.
Okay. Kalau misalnya kata oh kat situ lah.
Okay. So maybe we just wait for another 1 minute, then we will start. Okay, so we'll start now. Okay, Assalamualaikum and a very good evening. My name is Amin Ashari. I am one of the radiology MOs in HKL, currently doing my master's in radiology in 3rd year. So tonight will be a series, continuation of a series of webinars by HEART, which is Health Empowerment and Reform Team. And the topic will be Road to Master Medicine in Radiology and FRCR. So it's the 8th series of talks, and tonight we'll be joined by Dr. Kairina Adiliah Kamal Arifin, or more affectionately known as Dr. K, who is a radiologist in Hospital Temerloh. So just a short background about Dr. K, our speaker. She did her undergrad in Malacca Manipal Medical College, and then did her housemanship and also her MO-ship in Temerloh. Then she continued her master's program in UKM. So she's my former colleague and senior. And now she's a radiologist in Hospital Sultan Haji Ahmad Shah, Temerloh. She's also a social advocate for health and also radiology with her team, Med Tweet My, and very active on Twitter. She's also given talks in radios like Sina Harian, and also she's one of the authors of the book Perang Melawan Mitos. So without further ado, I would like to invite Dr. K to present her talk for tonight. Okay, please carry on.
Assalamualaikum warahmatullahi wabarakatuh, and good evening everyone. I cannot see the slides.
Okay, hang on. We set the slides, please. Okay.
All right.
All right, is it okay?
Yes, that's great. So today I'll be talking about the road to MMED radiology and also FRCR. I hope by the end of the talk, I'll be able to influence you, my adik-adik, to join us because we are rad like that. So what is radiology? So when people, next slide. So when people see us, the thing that they think about is like this person who hides all day in a cave and drink a certain thing to survive and hates the light. You have to understand those are not vampires, they're actually us. We're the radiologists. Next slide. So what prompted me to become a radiologist? You see, when I was a medical student and also in the earlier parts of my housemanship, I have no understanding whatsoever what radiologists do. I just understand that there are a bunch of people who are macam royalties, we would say, a bit on the angkuh side because we always go there and sort of begging them. So we felt like we were just beggars in front of a bunch of royalties, and we really didn't. I really didn't know what was the thing with radiology. Why are they like that? What do they do all day? Why are they so busy? Why do they look so busy? And one day when I was in my fifth posting, one of my seniors who was in Manipal, actually at that time was a MO in radiology Temerloh. He just got his master's punya acceptance letter lah. So he said to me, "Okay, you should see what we do. Take a break. Spend 30 minutes with me and see what we do." And that's a point that I really sat and look. Because lama ni, when I go down, I just go down, blah 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 blah, and then I go up. I never sit and see what they do. So I don't know why I had the time that day. So I spent 30 minutes of my time. I just sat and saw. There were actually a bunch of very busy people who were doing a lot of things in a lot of modalities. And at the same time, I noticed that there are, they deal with a lot of puzzles to diagnose. If you like puzzles, you like to diagnose, but you're not really good with patients per se, it's a really good thing for you to venture in. And also if you're very tech savvy, like I'm not that tech savvy, but I really love gadgets and computers and stuff like that, I bet you will love becoming a radiologist. So that was it for me. And when I went to my master's, and only I know what intervention was, because I never knew intervention was actually a thing, and I really got hooked. So yeah, that's what got me in. Next slide. So what do we really do? Why do I have to venture into this? Because many of the medical students and housemen, and even some MOs, don't even know what we do actually. So are we just a bunch of people who live in the dark, who, you know, sit in a cave waiting for the light? Next slide. So what I did was I did a small survey on Twitter, and this is what I found. I asked them to all the HOs and medical students out there, I want to know in your eyes what's a radiologist, and I asked for honest answers, and that's what I got. So next slide. Some of them really puts a smile on my face. Macam, in my opinion, I think radiologist ni power gila. Kena involve dalam procedure. And then ada someone cakap, medical student, I have a radio specialist who taught me and gave me the impression that radiologists are a cool and smart bunch. And we are really, get to know us really well. And some people say that always reminding students to at least write a brief symptom in the form to help in diagnosis. Yeah, because we're actually solving a puzzle. You cannot give us only one part of a puzzle for us to solve. Help us so we could help you. Tapi at the same time, ada orang cakap macam ni, radiologist paling seram. Lepas tu suka pandang macam nak makan orang. Yeah, we do that sometimes. Kata most of them are born to be radiologists. Rejectionist maybe. Okay. Some are very nice and accommodating, but some are really scary. Next slide. Lepas tu ada orang cakap, I love reasoning with them. It's a whole new level of discussion. They are hella smart. See, told you. And then ada je cakap, radiologist adalah orang bernampak walau sekecil-kecil stroke dalam CT. Kita cari-cari tapi lepas tu mata radiologist je yang nampak. And then some kata, bukan radiologist lah specifically, tapi orang-orang radio, I would say sombong, angkuh. Sebab orang je perlukan dia tak perlukan orang. And another person said, radiologist ni seram. And another said cakap, pretty smart. Nampak relax macam tak stress sangat. I'm thinking mesti best radiologist. So we have a myriad of answers, people thinking of what we're doing every day or not doing every day. So this is why I feel that I need to at least give a small introduction of what we do before I go into the specialty. Okay, next. So actually radiologists go across a lot of specialty, and I only knew this actually when I entered into my master's program, because you see, when I got into my master's program, I was only about 4 months a radiology MO, because when I entered radiology punya HLP punya borang tu, I was a KKMO. So during my 5th week of radiology, I went to the examination and the interview. So after that, baru I was exposed to radiology, and this is what I found, that we deal with like what, berbelas-belas subspecialties, and to be honest, I think kalau I belajar sampai mati pun, I couldn't possibly learn all of it. So as you can see, we have pediatric, MSK, head, neck, neuro, body, forensic, women, breast, hepatobiliary, cardiac, thoracic, interventional. That's a lot. Next slide. And this goes across all the modalities. We have the x-rays, which we are quite used to. Next. We have the fluoroscopy, which is essentially an x-ray, but an x-ray in motion, whereby we can see functionalities. Next slide. And of course, mammography, which is another type of x-rays, but a specialized x-rays only for the breast. And mammography has helped our country to become more, advanced in terms of detecting early breast carcinomas, which is really important in women's health. Next slide. Ultrasound. Not many people know that ultrasound could actually be done throughout the whole body. I initially thought that ultrasound could only be done with abdomen, neck, but I really didn't know that in babies you can do brain ultrasound, you can do spine ultrasound. It's really helpful, and ultrasound is nowadays we look for bowels, and it's going a long way, the ultrasound. Next. And also CT scan. I mean, who doesn't know CT scan? It's everywhere, and we do a lot of things with CT scan. Next. And state-of-the-art MRI, yeah, we have that too. Next. And interventional. I like to talk a bit more about it because not many spoke about it. Like in this photo, we can see that in the A image on the left side, there's a, you see the arrow over there? That's actually a stenosis part of a tibio-peroneal trunk, in which the patient will have ischemia to the legs downwards. By plasting and stenting the artery, we manage to get the flow back in. So it's really useful for these patients, and they don't get to lose a limb. Next. And also various other uses for interventional, such as image-guided catheter insertion, like the one on the left. And also the one on the right is showing an acute stroke in patients which the thrombectomy was done immediately. There was a reperfusion of the brain. And this is emerging in Malaysia. Not many centers does it, but it's really important as we have more and more young strokes. And these young strokes, they really need fast intervention because we are losing these people otherwise, and it's not good for our economy. Next. And another part of intervention is CT-guided biopsies, or CT-guided and also ultrasound-guided biopsies and drainage, so that we are more accurate as not to miss masses and lesions, especially the smaller unpalpable ones. Next. Okay, now that we've known what the radiologist does, let's go to the general requirements. So if you want to do masters, I'll go to masters first. You will have to, why did I put in bold the credit in SPM Bahasa Melayu? You need to have at least C5. If you are D onwards in your Bahasa Melayu, and I just learned this from my dear MOs, that if you do not have credit, you have to retake your BM paper as an independent candidate, because it really will bite you in the butt. You will never be able to get into the program because it's SPA punya, what do you call that? Requirements. So please, if you have any problems with your Bahasa Melayu, sort that first. And then as usual, you need to have any MD, MBBS, or from any recognized university by the MMC. 2 years of clinical experience after graduation, and this does not mean that you have to be in the radiology department. As I told you earlier, when I got into the interview, I just got into radiology, so the borang was processed during the time I was a MO in Klinik Kesihatan Teberloh. And you have to be registered with the Malaysian Medical Council with 3 years LMPT SKT of 85% and above. And you also have passed your MEDEX and fulfilled the entry requirements for the respective university, and has passed the radiology entrance test and the interview by the conjoint board. Next. So see, this is what I was babbling about in the form of in the nicer form. So we will, the first step is to take the MEDEX exam, which is the 800 ringgit. And this exam result is valid for 3 years. What it means is that if you take it now, say 2020, it will be, you can use it for 21, 22, 23. If you are not able to secure a seat during 2021 and 2022, you can still use it up to 2023. That's what it means. So it's 800 ringgit and it consists of 50 multiple choice questions, which is true, false, with minus marking, and it is 2 hours consisting of anatomy and radiological techniques. Then you get to fill the HLP form. This is only for the MOs with permanent posts. I will talk about the contract MOs slightly later on. Please bear with me. And they have serviced the KKM for at least 3 years, meaning including the housemanship. And you have the LMPT of more than 85% for 3 consecutive years and age of not more than 43 years old during your application. And then we have the radiology entry examination, which is an OSCE for 1 hour. You have 20 questions, and also rapid film, which is 25 films for 30 minutes. And then afterwards, you will be interviewed by the Conjoint Board of Radiology, that has what do you call that? Representative from KKM and all the universities involved. Next. So usually when a person gets accepted into masters, there will be 2 pathways, which is cuti belajar bergaji penuh with HLP or without HLP. So with HLP, cuti belajar bergaji penuh, I can say that you're almost set because your tuition fees are all cared for, but you have your contracts to go with, but that's okay. The ones without HLP, in my experience, I've only seen 1 person in radiology. And I'm not sure if there's any more after that, and that was during 2016 batch. But this person, if you take into consideration that she gets a graduate on time status, she or he will have to fork out about 33,000. And this is the calculation as follows lah, the registration, the semesters. And if the person doesn't make it, so she or he will have to add on as per jadual lah. And this is 2016 punya jadual. So I'm not sure what's the latest. This is according to university. And this particular 33,000 is actually for UKM. Okay, next. So these are the choices of universities that we have for master's program. We have UKM, in which we do the rotations in HKL and HUKM. We have the in-campus or the out-campus program. The out-campus goes to Hospital Klang, Selayang, Sungai Buloh or Serdang. And we have USM. Again, we have in-campus and out-campus. For the out-campus, we have Hospital Alostar, Penang, Kuantan, and also Ipoh. And UPM, we have Hospital Serdang, Hospital Pengajar UPM, WCH, which is HKL, Women and Child Health Care, and also Hospital Sungai Buloh. And lastly, we have UIA, which is the UIA Medical Center, and Hospital Kuantan, done in rotation as well. Next. Okay, now we're going to the FRCR pathway. The FRCR pathway needs a minimum 1 year post-clinical experience, meaning that you finish your housemanship and you have finished 1 year of your clinical experience anywhere. It could be anywhere, but preferably, according to KKM, preferably you were in at least NSKKMO or KKMO, medical or surgical. But I think anywhere is okay. And you haven't had any disciplinary action before, and your LNPT marks is more than 85% in 3 consecutive years. Next. So say you have taken your part 1 and you have passed both, which is in physics and anatomy, then you can start training in the radiology department, in which that once you pass, you can submit, if say unit clinic kesihatan, then you can submit your transfer into the hospital, saying that you need to start training in the radiology department because you need to continue your parallel pathway. Similarly, if you're in a hospital, you can submit to the pengurusan that you want to change department. And and then you have to register with Cawangan Pembangunan Profession KKM to show that you are in the system already. And the requirement for you to sit for the final part is that you need to fulfill the requirement as per FRCR examination, which is you have to pass the 2A and you have completed 3 years of radiology training with the required number of procedures as well as mini logbook, and it has to be verified by your supervisor. Okay, next. So if you're wondering of the fees, we are considered non-members. So our fee is as follows. It's about £300 to £500 depending on which paper you're taking. Usually we will there are three places for us to take. One is in the UK, one is in Hong Kong, another one is in Singapore. There are pros and cons. Like Singapore, it's cheaper, it's nearer, but for anatomy, it's very hard to get allotment. So I went to Hong Kong instead because Hong Kong gets slightly easier allotment. The prices is a bit high. And then if you go for 2B, you can choose to go to either 3, but Hong Kong is very tough. UK is quite what do you call it? It's not lenient, but they are fair enough. If you take the exam 2B in UK, they say it's fair, but it's expensive in terms of tempat tinggal and then the flight tickets. And if you take in Singapore, you will have to add an additional $3,000 because you will have an additional degree, which is awarded by the National University of Singapore called the MMED Diagnostic Rep. Next. So these are the curricula in for masters in short. So basically, masters, the minimum for you to finish is 4 years and maximum is 7 years. But this 7 years is because of the contract with HLP. So it might change from time to time. And for part 1, we have anatomy, physics, and techniques. You can see more detailed in the jadwal on the right hand side. And part 2, we are to diagnose pathologies. And part 3, we have to know normal and also pathologies. Next. So the master's exam consists of part 1, 2, and 3, in which part 1 is anatomy, physics, and techniques. We have multiple choice question, which is true, false with negative marking. And then we have the OSCE. Actually, OSCE 2 is supposed to be another point. Never mind that. We have OSPE, and we have Viva with 4 examiners, 15 minutes each examiner. And we have part 2, which is the pathology, which is a single best answer. We have 2 papers, 3 modules in each paper, a total of 6 modules, 2 hours and 30 minutes. And we have film reporting, I think 2 hours and 30 minutes per paper. And then we have film reporting, and also we have Viva, 4 examiners, 15 minutes each examiner. And part 3, we have recognizing normal and abnormals, in which we are just given plain X-ray, 25. We have 30 minutes to complete them. Okay, next. So yeah, on top of passing your exams, you have to complete your logbook with 3 case reports and 1 dissertation write-up, as well as compulsory rotation in PEDS, IR, and also molecular imaging, which is nuclear medicine. Why did I put the dissertation write-up merah, besar? Because it's actually the pain in the A. I would say that this one is the one that costed me the most heartbreak and heartache. I mean, yeah, exam is tough, but at the same time, the dissertation really kills me because I'm not the kind of person who can really write. But the thing is, you still have to, because it's a part of your requirement. And there were some of my seniors and juniors who actually sangkut this part, and it's not nice for you to sangkut when all of your friends has already left and your dissertation is still on the hanging. So yeah, if you really cannot write, you have to, you know, have a strong heart to finish writing or not take masters. Next. Next. So this is the FRCR curriculum and examination. As you can see, this website is for the curriculum. It's like 30 pages long curriculum for you to go and have a look if you plan to start taking it. So we have first FRCR, final 2A, and also final 2B. First FRCR, physics is the killer. They have 200 true or false question, and there are 40 stamps, and it's true, false, and the paper lasts about 2 hours, and the passing marks is crazy high. During my time, it was 80.1%. I actually failed the first time around when I took it in Hong Kong, and I retook it again in Singapore. The first time around, I only got like 79.5, and the second time I got 89 because I was like really, but once you really get to know how it is, it's actually not too bad, because actually physics is very volatile but um, very learnable. And the anatomy, the problem with anatomy is not just the question. The questions are okay, quite tough, but in comparison to physics, physics is tougher. But the problem is ballotment. So you need to have a good luck for you to get balloted. Some people finish their physics earlier on, but took another 2 years to be balloted. So yeah, you might have to pray more for that. And then for the final 2A, there are two papers set on the same day, and each paper has 120 SBA questions, which is 240 in total. It's a total of 6 hours paper. I took mine in Singapore, and during bulan puasa, it was hectic. And because we had to follow the UK punya time, so we started at 2 ke 3 and we finished somewhere around 9 o'clock malam, and buka puasa in between. So it was quite funny because bila buka puasa tu everybody was answering the questions, and suddenly time for buka puasa, everybody go semua orang buka dia punya packet of biscuits and everything. Everybody start eating silently and then sambung belajar. So yeah, it was like that. So that was tough. I didn't pass that. I didn't pass that. I have to resit it again. So yeah, and then COVID came. So anyway, and then we have final FRCR 2B, in which they have rapids, 30 plain radiographs in 30 minutes. And then we have long cases, 6 cases in 75 minutes, and also the Viva. Final FRCR 2B is also another pain, because not only that it's difficult, you still have to be in line and balloted as well. And since we are in the COVID era nowadays, up to 2021, at least till March, we still haven't gotten we've gotten any hope to go yet, because the what do you call that? The examination is still not open for international candidates. So they're open only for the Singaporeans, the Hong Kongers, and also the UK people. So for now, it's kind of put into hold. So let's pray that everything will be, okay. Next. So on top of that, in Malaysia, we need to complete our logbook. Actually, logbook tu we need to complete for two reasons. Another one kan, we need a supervisor signature to present to the RCR to tell that okay, we have finished our 3 years program. 3 years rotation in the system, and we are ready to sit for your exam. That's what it means. And also we have compulsory rotation, in which we still have to do PITS for 3 months, IR 3 months, and molecular imaging for 1 month. Next. Okay, before we go to examination track, I would like to highlight about the MO contract punya choices lah. So for now, because I have called quite a number of people, I called the PT in charge of MOs, I called the university punya people, and I also tried to call bahagian perkembangan profession in KKM. And for now, I think what I could conclude is, for contract MOs, your choices for now is one, the parallel program, which is not too good now since it's COVID, but I think eventually they will find a way to do it, because MRCP has found a way to do it online. So I think eventually we will find a way, and the vaccines are coming, so we hope for that. And another thing is probably we can try, okay, there's another way for you to do it, which is to become MO service in uni and then proceed to masters from there. But you have to realize one thing, that you have to resign from KKM, number one, and tak janji pun boleh dapat radiology. So that's a risk to take. And another choice is, another bukan choice pun, option lebih kurang, is to keep updated with the guidelines from reliable sources such as KKM punya bahagian profession or Perkeliling Terkini and the universities. Because for now, what I was made understood is, if an MO contract gets the master program, it will be quite messy, because how are they supposed to get the cuti belajar bergaji penuh, or HLP or non-HLP? Probably eventually they will think of a way to get you into masters, but with full out-campus program. I don't know, but that is still in discussion, and we will see in a matter of a few months, years. But another thing is that I don't know, because I'm really sorry for you guys for now, but really, if the parallel pathways open up, it's best for you to try to take that now. Because sometimes maybe your contract can get renewed and you become permanent, then we can also pray for that. Okay, so for gazettement track, for masters, after we have completed our graduation, we will have to go for a 6 months gazettement with logbook and the supervisor's narrative. And for FRCR, the gazettement is 18 months post to be. There will be 1 year of pre-gazettement, meaning you're still working as an MO, but a senior one, meaning you're not really a radiologist yet, but you kind of are. And this is the time that you get to finish all your attachments if you haven't yet. Meaning if you haven't completed your 3 months in PITS, it's time for you to complete them. So, and there's also this, after you finish your 1 year pre-gazettement and you have completed all your attachments and your supervisor is happy with you, and you can be upgraded to become the 6 month gazetteer. Again with logbook and supervisor's narrative. Next slide. So this is the places where you can do your three compulsory rotations, which is pediatric, interventional radiology, and also molecular imaging. Okay, next slide. Okay, so the tips to succeed. For us, as a postgraduate, it's not the same as undergrad. It's a lot different because you're not only talking about yourself now. You're talking about yourself, your spouse, your children, your aging parents, and it's a lot to handle, you see. So it requires a lot of sacrifice on your part, on everybody's part. In fact, your children have to sacrifice, you have to sacrifice, your husband has to sacrifice. So it's a lot of sacrifice. Your willingness to sacrifice your time, your energy, and also your money. Yeah, it's a lot of money actually. So that's number one. Number two, you need to have a very strong family support. So that's why I put my family's picture. So for you to take care of your child or your sick family members, if you have any, so that you could do your work more comfortably and not think of any of the confounding factors. Next. And it's very important for you to have a bunch of people to always be with you. So these are the pictures of my batchmate and also my study group. Without these people, I'm nowhere near where I am now. So when I first started my my master's program, the first 2 months itself, my girlfriends have already approached each other. We said, "Do you want to start a study group?" Yeah, we should start a study group, and that's what we did. We started a study group, and now here we are. So and the willingness for all of us to sacrifice our time. 5 months prior to the exam, we actually spent at least, we come to work at 6 in the morning and we went back home at about 8 for us to study. So it's a lot of heartbreak and heartaches at that point. But you have to remember, if you don't deal with the heartbreaks, then there will be longer heartbreaks. So yeah. Okay, next. And of course, my beloved lecturers, and you need to always be open with your lecturers. If you have problems, you talk to them. If you cannot do anything on time, such as you have problems like me, I have problems with this dissertation. Dr. Erika almost knocked my head saying, "King, you are so careless." She had to betulkan my proposal 7 times because of my tak reti tulis and carelessness. So she was really helpful to me. So a very helpful supervisor is really everything, and your lecturers too. And you must be apa orang panggil, muka tebal, for you to not be ashamed to ask for tutorials, to ask questions. And even some private tutors, I mean bukan private tutors lah, some lecturers, once lecturers who became private practitioners, are even willing to teach you. Why not give it a shot? Next. And your daily work is really important. You have to put your heart in your daily work. I mean, it's really tough. It's tiring. You dah nak kena belajar, you nak kena jaga anak, you nak kena, everything. And then you nak kena pergi exercise, sebab takut you gemuk, and things like that. Tapi once you put your heart in your daily work, it's actually already half of whatever that you need to know and you need to do. So, And a good team helps too. See how happy we are? Say next. And also networking. Yeah, this is a photo of us with Datuk Samad, the one in the Thai, like the radiology punya father of radiology of Malaysia. So he taught me a lot too, his classes and everything. And these are my friends from KPG Hospital, from Hospital Putrajaya. And on the right is our photo with the HKL punya radiologists, and they were really helpful. They were really knowledgeable. So I always have them. So it's really I was really grateful for that. Next. And also not to forget my team who always have my back if I want to bawang, if I want to apa, if I want to, ask for help. They were always there for me, and they will always celebrate our differences and our challenges, our successes. So it's very important for you to have people who have your back. And lastly, next slide. And this is a photo of me in HKL post call. I couldn't remember how tired I was, but this was my last day as a junior before I went to registrar. So whatever it is, you have to usaha, usaha lagi, and then tawakal. Because eventually, it's God who will help you. Allah will help you. So I hope that it's clear. If you have any questions, you can ask us. And I have prepared a video consisting of my friends sharing their experience. I hope you guys can, have a look.
Okay, thank you very much to Dr. K for the extensive information on radiology and also the career path in masters and also FRCR. So actually next we have Dr. K has worked really hard to get a compilation of inputs. So it's compiled in the montage which we will show after this. Okay, so stay tuned. All right. Okay, can we play?
Cool. I would like to share to you my journeys of masters. I'm joining master's program a bit later compared to the rest of my friends. At that time, I thought that I want to complete my family first. When I was first year, most of my friends already in third year and fourth years. So, but most important thing in life, before joining masters is you must determine your support system from family, friends, as well as your teammates. And another thing is you must have willingness to work in a dark room with dimmer light, working with different shades of grays in CTs, X-ray, at the same time helping people, your primary team appropriately. Of course, journeys of master's program full of challenges, very tough, high commitment, but we have a lot of good moments as well. Believe me, I didn't manage my part one first attempt, but I did better in the next paper. And in my second year, I was tested. I got a subdural bleed, which required surgery. And my supervisor told me at that time, Fauzia, get your treatment done and get how much time that you need to heal. And once you're ready, and get back to us, joining us again in master's program and try not to quit. It takes 4 months for me to heal physically, and I need to defer my master's program for a year for that. And I'm joining back service MO in HKL before joining masters in again. But being in HKL also one of very good experience, learning experience, working with experts, subspecialties, good primary teams, as well as most of your seniors is helping you and supporting you. And then it was not stopped there. I got pregnant after that, but Alhamdulillah, after delivered my baby, I managed to pass my part 2 and part 3 smooth sailing. And my tips and my advice to you guys for all the young people's journeys of masters, not just reading books and pass the exams. all people around you are also a good learning tools and experience, either indirect or direct way. And you need, and in future you need to develop your own passion in radiology on your own. So all the best.
I am Chan from UMMC. I previously did my master's under UM and graduated last year just before COVID hit. I was told to share with you guys what the experience is like in UM by a colleague of mine, Kay. So in UM, basically when you first join, in the first years, you're expected to actually do procedure preparation, patient preparation, to learn about the indications, the contraindications of procedures, and also the basic steps to simple procedures, for example, ultrasound or simple angio interventional radiology procedures, and also like, for example, how do you prepare a patient that needs a PET scan? How do you prepare a patient that needs a coronary CTA? Those kind of things. Aside from those, you're also expected to learn normal anatomy. All right. Okay. And in second year and third years, you'll be expected to know more about pathology, to do report mainly CT, MRI reportings, the more complicated ones. And in fourth year, as a final year, you're actually supervising a lot of your juniors and also reporting more complicated cases at the same time. All right. So what do I think about masters? I think masters is quite good if you either have a part 1 in FRCR or if you're totally new. Okay, you don't have any experience at all. So masters will be quite good in that sense. However, if you already have your part 2 in FRCR, I would actually advise you to just complete your FRCR part 2B because that would be faster. But I was also told by a few of my friends sitting for FRCR that right now, due to the COVID situation, a lot of the Part 2B exams were postponed, and it's more difficult to get a seat now. So it depends. Okay. Yeah, I think that's all. Thank you.
Hi, everyone. Hello, I'm Dr. Tilaga, radiologist from Hospital College Peace. I completed my master's program last year as an in-campus student in USM. I was asked to share a little on my experience about a master's student. So, of course, master's was not an easy journey. It demanded a lot of commitment from us and a lot of sacrifices. And I would say the toughest of all was to leave my daughter back in my hometown and not being able to see her for months at times. So that was one of the toughest ordeal, I would say. Other than that, about the master's program itself, okay, of course, first of all, you will be expected to be fully independent. Okay, no one's going to spoon feed to you any knowledge. It's all about you learn from what you do every day, what you see your seniors do every day, and how you go back and read on the cases that you're reporting for the day, and so on. We depended a lot on our seniors to shed light on how the preparation for exams should be done and how early we should start preparing for exams, and what are the books that must be read. Certain books like compulsory, like this examiner will expect you to have read that book, and so on. So usually we depend on seniors to give some tips. And of course, I think teamwork is very important. Okay, group studies is one of the most paramount important thing that helped me, because we had a team of about 4 or 5 hours, and we would gather every day, including weekends when we don't go home, and we would sit and study for 4 to 5 hours every day. So I think that is very important. And other than that, don't expect it to be easy, or don't expect it to help you in any way. It's all about how you help yourself and how hard you can be prepared for the battle. And I wish you all the best. Thank you.
Okay, hi everyone. I'm Dr. Shafiq. Recently graduated radiologist from UPM. I was told to share some of my experiences as a master student. I just graduated yesterday, so it was a long journey for me compared to the other colleagues from other universities. Ours was a bit unique because we were the first graduates from UPM. We didn't have any seniors, so we had to depend a lot on our colleagues from other universities. I'm not going to talk about what to do during the master's program because I think because of the layout of the program and the conjoined board, everyone goes through about roughly the same program during first year and also during second year and so on. So I'm just going to tell you this. It's a journey. It's not a race. So try to finish it on your own time, but try to finish it as soon as possible. Enjoy it. There are going to be ups and downs throughout the process. Do what you like. As you can see, I just finished my 7.5 kilos run this morning. So I just did what I liked during the program. Life goes on. There are big challenges in life compared to masters, but if you persevere, you can hopefully finish it. So my two take-home messages would be number one, persevere, 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 and number two, just work hard and remember that everyone has their own timeline. So I wish that to you all. And whoever is joining UPM, you will see me as a lecturer and hopefully we'll have a great time during your journey. Thank you.
Assalamualaikum and good evening. I'm Muhammad Arif Kawarin from JB. I'm a radiologist in JB. I was asked to actually give my experience during my FRCR journey that I took. So, first of all, I entered radiology in 2015 and took my exam FRCR 2015 and finished it in May 2019. So for the pros and cons for FRCR, the pros would be that I don't need to move anywhere. Since I'm staying in JB, I don't need to go to Klang Valley for my masters in either in campus or campus, and I actually can study at my own pace. The cons would be there's no structured learning for FRCR, and you have to actually learn by yourself, read the books by yourself, and you need motivation to actually do that. Otherwise, for the courses that I take until I finish my FR, there's a few courses that I took, I actually attended in Malaysia. The Zoom course by UiTM and FRCR course done by KKM as well. The courses that were done in overseas was, I did not attend any of those, but from my colleagues, they told me that it was a good experience as well. And I actually learned from them as well. So for the fees, for overall my FRCR, it took me about maybe 25 to 30,000 ringgit. Because I took my exam in Singapore, the fees for the Singapore exam is about 20,000. That's all. Thank you.
Hi, I'm Dr. Kelly. I'm a radiologist currently working in Hospital Sibu. I'm a FRCR holder and I passed my exam in October 2017. My initial intention of passing first part of FRCR was hoping that I could get I could secure a place in master program. However, during that time, under the mentorship of Dr. Noyati, who is one of the pioneers in establishing the FRCR program in Malaysia, I was encouraged to take up this FRCR pathway, and I eventually did. I would say it's not a totally easy journey, but it's definitely doable. Good things about FRCR, first, of course, it's internationally recognized, and secondly, you can take each part of the exam at your own pace whenever you are ready. And after you pass your exam, you don't get bond, unlike in master's program. And fourthly, of course, if you have money, you get to attend overseas courses, and you can exchange knowledge with other overseas candidates in UK or Singapore. And of course, if you plan to set up family, maternity leave of 3 months will not be an issue. But in master's program, you need to defer. Okay, and in FRCR, you need to be independent because you have to apply and to plan for your postings and attachments in respective hospital, for example, the pediatrics, interventional radiology, nuclear medicine, and etc. So unlike master students, they have these structured programs. They just have to follow, and they have also lecturers and professors that are available to readily answer their questions and to guide them during the master program. And FRCR involves money, and this includes exam fee, overseas courses, online revision, flight ticket, accommodation, and food expenses, especially when you're in the UK. And the total exam fee from first part to second part or last part to be, and it can goes up to total of 10K. And it depends on the attempts that you do. And the average fee of a course in UK is about 3,000. And the courses that I went in UK, Rapid Reporting in Northwick Park, Edinburgh, FRCR Master Course by Dr. Samir, the King's College, and also Royal Free Hospital. And you need to find time with FRCR tutors, local tutors, during weekends and also after office hours most of the time. And also to look for study partners to encourage and to practice together to be comfortable to go for exam. And there are limited seats for overseas exam. We have to go through ballot system and the first come first served basis, especially the final part where you have to wait for it, and the waiting time can be very, very long. And lastly, you have to pay membership fee every year to the Royal College of Radiologists. Well, whichever pathway that you choose, do it with perseverance, discipline, and just enjoy the journey, and you will eventually reach your goal. There was once somebody said that in order to succeed, you must first believe that you can do it. And that's all. All the best to you all, and thank you very much.
Warahmatullahi wabarakatuh. Thank you, moderators and organizers, for inviting me to share my tips of doing master and FRCR exam. I'm currently radiologist in Hospital Ampang. To begin, the pros for masters is a well-structured, guided program. You have your dedicated lecturers, you have your conjoined examination, you have conjoined class. You got to build your confidence very early, since you have your Viva exam even at your part 1 examination. You got to stay in very conducive environment where you have your friends of doing same examination at the same months and at the same year, and you also will be more familiar with your local examiners and the local papers. You get to do a lot of networking while doing master's program, since master's program is you got to meet your friends of the same year of at least 14 to 20 students per batch. You got to meet your seniors and juniors of 4 different batches. You got to meet the radiologists of different subspecialty, which is very good to make friends. As is a point to survive once you become a radiologist. The cons, of course, cuti is limited. You have no proper maternity leave. If you got delivered during your master's years, your sometimes cuti got frozen. Your MCs is your cutis, and of course, some people who dislike thesis and research is part of the requirement to do one research during your master's years. FRCR, your exam is more flexible since you are doing it at your own pace and timing. But there is hiccup, of course. Some people have to wait longer time to get your placement for ballot and anatomy examination, as well for the final part 2B examination. For myself, I have to wait for one and a half to 2 years before I get my final sitting of the 2B examination. For FRCR, you have to get a good financial support. Since final 2B, you requires at least 10,000 to 13,000 ringgit Malaysia to do the final 2B examination. FRCR is not a shortcut since gazettement is longer. It's 18 months compared to your master's plans, which is only 6 months. For both have similarities since you still have got to do your case reports, at least 3 case reports throughout your journey. You need to handle clinical and radiological conference for at least 12 times during your FRCR journey. You got to do your logbook for your privileging as well as for gazettement requirements. You cannot run away for angio rotation since angio you are required to do 3 months angio rotation, 3 months space rotation, as well as 1 month nuclear med rotation. As to conclude, both journeys have the sweet and sour part of it. Good luck. What pathway you choose, just stay motivated and dedicated. Begin with end of mind. You want to finish within 4 or 5 years at least if you are doing FRCR. Attempt FRCR even you entering master as a plus point for your personal self as well as to increase your knowledge. Okay, good luck everybody. Bye.
I'm Lee Chong Yan from Pusat Jantung, Sarawak. So today I'm going to introduce the pathway to become a radiologist in Malaysia. There are 2 pathways, namely a local master program and FRCR. So we start with the FRCR first. FRCR, basically you are doing on your own time. And the day when you choose to sit for your part 1 exam is the day when you decided that I'm prepared and I finished reading out physics and anatomy and I can walk into the exam hall. And Ministry has set a guideline. The day you pass your part 1 exam and the day you finish your final paper, it must be at least of 4 years of a gap. That means 4 years of a radiology experience before you can start gazettement. As compared to a master program is more structured. The day you enter first year, you know that if you work hard and you follow whatever instructions they are given, you will pass the exam in another 4 years. And after that, you can start your gazettement. The thing is, nowadays, many people find it hard to enter master program. Hence, they are starting off with their FRCR part 1 first. For me, there is no harm. If you have a radiology experience coupled with the passing of your part 1 exam, once you enter master program, it's definitely a complimentary and added boost to your CV. Okay, so now I'm talking about those people who has decided to sit for FRCR to become a radiologist in Malaysia in their hometown. What are the advantages and disadvantages? The advantages of sitting for FRCR is that you don't need to leave your hometown. There's no adjustment disorder. You are familiar with your friends, colleague, and your, let's say, primary team, and it's your home ground. The cons of sitting for FRCR is that you need financial power. Another one, you need to be motivated and resourceful. And but for me, if you are confident of passing your FRCR exam in, let's say, 4 years, you just go for it because it's very competitive nowadays. There are many doctors, and everyone is vying for the narrow spot in the local university for master program. I am not going to, put down any candidates. Choices are yours. Ultimately, all of us going to become radiologists in future, and just the pathway that we take are different. In my experience, I set for my FRCR before I enter master program. So when I enter master program first year, I have my part 2, and I find that my knowledge helps me a lot, and in my clinical experience and radiology experience, it makes my work smooth and quick. When I'm in third year, before I set for my third year exam, I passed my FRCR. And then when I enter my exam, I find that the questions they ask is near similar. The way they ask the questions and the way to approach it. So FRCR, in fact, helps in my master program. Okay, all the best to everyone who have decided that they want to sit for master FRCR. Choices are yours, and good luck.
Okay. Okay, so we're done with the video. So a lot of insightful inputs from radiologists from different backgrounds. Actually, we are a bit short of time. So we have few questions from the floor. So I'll take the question from Hidayah Zainuddin and also combine it maybe with Winnie. So the first question is, do you mind, Dr. K, do you mind sharing books or resources for FRCR Part 1? And also if there are any online study groups or tutors by Winnie. Sorry. Dr. K, unmute yourself.
Okay. Internationally, there are a few places that you can go. I mean, what I mean by international is it's actually online, tapi it's international. So among the places that you should go is to radiologycafe.com. So there you will find all the resources. But as for me, for my anatomy, I practically gulped my my atlas. My anatomy is atlas. I had 2 anatomy atlas, which is the Frankenstein and also the Jamie Wire. Those 2, I really ate them sampai kenyang. Okay, and then for my physics, on top of reading our usual FARS, I also went to BMJ on examination. BMJ on examination is a paid site. I took 3 months, so which is about £46 according to current currency lah. So I paid 46 £46 for 3 months, and they have about 300 questions over there, and the questions are seriously similar. And I told you the first time around I only got 79, the second time around I got 89. That was really thanks to BMJ on examination, but that was during my time. I think it's still relevant. And as for study groups or tutors, there is a WhatsApp group for the FRCR punya support. So if you are interested, and we can put it in.
Okay. Next question is, can you explain a bit more on allotment for the FRCR exam?
Allotment ni senang cakap, undi lah. I give you contoh masa first part lah. During my first part, kan you daftar kan? You daftar for both anatomy and also physics, and they will and you don't have to pay yet for your anatomy. You pay for your physics first because you confirm nak duduk. And then they will pull up a allotment. Kiranya you put your name up first, and then like 2 months to 3 months prior to the examination, they will email you to tell that you got the place or you don't get the place. If you don't get the place, then next time around, setahun dia buat dalam dua ke 3 kali macam tu, you have to put your name again and hope for the best. Nasib you dapat, you diundi, and then you can sit for it.
We have the last question. The question again for FRCR, do we need to complete the logbook during part 1 before entering part 2 or after starting part 2?
Okay, actually this logbook is important for you to buktikan yang you have gone through what's the word? The attachment, I mean the postings in radiology for more than 3 years for you to be fit to sit for 2B. So after part 2, you boleh start lah. It doesn't have to be during part 1 before entering part 2. Yang penting before 2B. During your 2A tu pun you boleh buat, no problem.
Okay, so just nice on time. So that's all the questions we have. Thank you very much for staying tuned, and you can visit Facebook again for the recording of this this webinar. So we'd like to thank you, Dr. K, for her time for tonight, and also for all of you who attended this talk live or recorded. Or the recording. I'd like to ask the courtesy of all the listeners to fill in the survey at the end of this talk. And so thank you very much again, Dr. K. So that's it for tonight, guys. Thank you.
Thank you.
And do fill in the survey, okay? So we wait what's the next topic going to be from Hart. Okay, bye.